Steph, I was going to say I can get in there again and help weed out if you need or whatever.
Okay.
Whatever you guys need me to do.
Thank you. Looks like we are recording, so we'll go ahead and get started. Some folks may be hopping on as we begin. I know it takes a moment. You gotta get your camera turned back on and agree to be recorded. All right. Good morning, everybody. Thank you for being here today on Tuesday, December 3rd. My name is Stephanie Kucher. I'm the Quality Improvement Coordinator here at Starkmar, and I'll be kicking things off today. I think we're going to have some folks hopping on as we get started. So just a couple housekeeping reminder items that this session is being recorded and it will be uploaded to our YouTube channel so that you can access it later on, or if you have staff who couldn't make it today, who need to watch it, they can access that as well. The link to the past two Q&A sessions are already on our website, and this one will be as well. And that's www.starkmar.org, and right on the home screen, there's an orange rectangle that says SFY26 RFP. So you can click that to get to the links for the videos. So now that the RFP has been released, just a reminder that questions can be asked in this Q&A session or through the designated RFP questions@starkmar.org email address. So if you send a question to the RFP questions email, we try to work to get you a response within 24 hours. And then all questions and answers through that email address, through these Q&A sessions, will be transcribed and made available to view on our website. So at that same location on the website. So this session today, it's our last Q&A session, and it will only share the updates from last year to this year. So Chris and I are going to be talking about the same thing as in the second Q&A session. So it'll be the same presentation, but this is a chance where we'll pause for questions that you may have, either on the things we present or as you are working on the RFPs on your end. So again, if you missed any of the Q&A sessions, you can find them on our YouTube channel. The first Q&A session, just a reminder, walks through every single form. So if you need that refresher, look for that first Q&A session. I believe it was on November 6th. So that one and the second Q&A has already been posted. And then this one will be shortly after today. So if you need to access the RFP documents again, maybe you can't find the release email, or maybe a staff member needs to look, you can pull up the documents on our website at that same location. So starkmar.org, click that orange button from the home page. All of our forms will be listed, as well as those links I talked about earlier to our Q&A sessions, and then the transcribed questions and answers that we've received so far. So I think that's it in terms of the reminders. So I'm going to go ahead and jump into sharing with you some of the documents that have been updated since last year. So I'm just going to highlight what has changed, and then I'll kind of pause at the end of each document to see if there's any questions, and I'm sure we'll have time at the end for other questions that might come to mind. So I am going to share my screen on and off today, so bear with me. I'm going to look to my side here at my other screen. So let me pull up the first document. I'll share with you all shortly. And I invite Starkmar staff to jump in if I miss anything when I'm talking about any of the forms. All right. So this first document is a PDF that was included in the release email, and it's evidence-based treatment, prevention, and program models. So the information itself and the concept is not new, but it was once included in the RFP guidance document. So there was a small section that listed some of the evidence-based models and practices that are supported by Starkmar. And our clinical team did some research and really expanded that section. And so due to its length and the content, it has become its own PDF now. So that's what I'm sharing with you now. So this is just a reference document. There's nothing to complete on it. It is 4 pages, and we list the models and practices that are approved and supported by Starkmar. So if you are implementing any of these models or practices in your programs that will be in your RFP for 26, please make sure to include that, because that will help strengthen your ask. So I'm not going to walk through all of these, but just kind of share with you the visual. So what we have are the program name, the age and population, and then a resources column, which takes you to the website for that model or practice. So if you're interested in any of them, you should be able to access the website there. We have this broken out by program models. You'll see prevention models. There's going to be a lot of scrolling today, so bear with me or look away if it makes you kind of queasy. We have evidence-based treatment models as well, and they're all listed alphabetically there in case you're looking for a specific one. So it's quite lengthy, but just wanted to point that out to folks. I'll stop sharing so you got the gist of it. So that PDF is there as a reference for you as you're developing your narratives and your proposals. I'm going to pull up our face sheet, checklist, and guidelines document. There's only a few changes on this document. Point those out here. So, all right, sharing that one. So this should look familiar to folks. Really small changes in this document, but we just wanted to point those out to you. So here's your first face sheet page that you'll complete as part of the RFP submission. If you did one of these before, you may remember towards the bottom here, there was a section for DUNS number, D-U-N-S, and that has been replaced by this UEI number. This is a link to take you to the page that explains that change and gives you a little more information if you're interested, but that's the only change on this page, was that DUNS number was removed, and then we kept this UEI number since that had replaced the DUNS number. I'm going to keep scrolling. So this is the checklist that you'll also complete and submit to us. This used to be page 3 in this document, so we flipped it to 2 to make it easy, like just complete pages 1 and 2 from this document and include that in your packet. So hopefully that helps, so you're not doing page 1, then page 3. So pages 1 and 2 here. It's the same information as last year. It just looks a little different. We kind of color coded it based on the different program types. Hopefully that's easier on the eye for you. And then as you complete and include any of these documents as they apply to your program, you can just click and check. So what we did here was really the only change, this is kind of small, make it bigger. We just added a statement here under consultation and prevention, just a reminder that that C&P chart, although it's a required document, it'll be released at a later date, and that will be on January 3rd. So once we see who submits RFP narratives to do consultation or prevention programs, we will then email those folks the C&P chart to complete. So we didn't want to confuse everybody by sending the chart out, and it doesn't apply to some folks, but it applies to some others. So and that C&P chart has a later due date of the end of February, and that's intentional so that Starkmar and the providers can hopefully meet with the locations for those services, the schools, to determine the need and how much of each service they may need for the next school year. So although that process piece hasn't changed, we just added that statement in there to acknowledge it as a required form, but just not do it this time. Right, I will keep scrolling. So on this next page, and this used to be page 2, so we just flip-flop those last 2 pages. We did add a statement or this paragraph here. And this was true last year. I think we just kind of spelled it out here this year that if a provider organization has not been certified by Ohio MOS for the services that they'd like to provide, they can connect with an already certified provider already in our network and see about partnering and then being included within that RFP proposal. So that would help a smaller organization either have a little more time to get certified on their own, or if that just isn't a good fit for them, they can still provide services. I don't think it's happened yet, but that is something that we're open to. So we wanted to include that here in this document. And then the next change is just formatting, and it's at the very last page. So I'm going to scroll really fast just to get to that page. So it's literally a formatting thing. So when it talks about the version of the narrative and budget to complete based on program type, same for personnel cost schedule, that was just changed to a chart format because it was all spelled out in a big paragraph and there were a lot of words. And so hopefully condensing it to a chart maybe helps a little visually, makes it a little clearer for folks. So the information hasn't changed, just the format. So those are the only changes for this face sheet checklist guidelines document. I will stop sharing and then see, are there any questions about that specific document? Great. So next, I will pull up our RFP guidance document. Share. Right. So I'm going to scroll to our first change, and that's under the expectations section. And the first change really starts on page 5. It's kind of broken into pages 5 and 6. So we added language that any staff providing direct services to clients who do not hold a license by an Ohio licensing board, and we have the examples there of the various boards, those staff must complete any required trainings per Ohio MOS and the OAC rules But additionally, StarkMar is requiring those staff to receive trainings in these areas that are checked here. So you'll see HIPAA and 42 CFR, mental health first aid, QPR, verbal intervention, training around cultural and linguistic competence, trauma responsive care. And we do recommend motivational interviewing. So we just wanted to outline those expectations there for folks, again, doing direct service, not holding a license from a state board. So we also added, of course, any program-specific requirements will be outlined in the provider contract. As anybody here who's currently working with us would know, that separate Section 4 attachment if funding's approved for that program. So that's our first change from last year to this year. And I'm going to scroll, so bear with me. I'm going to go down to the school-based services section. We just added one sentence here, but wanted to point that out, that school-based clinicians are required to hold a master's degree. So again, this is our document that outlines kind of our philosophy and perspective of various services. So we wanted to outline that expectation for school-based clinicians here. You know what? I'm going to go back to the table of contents and just jump to where I want to go next. That's to the evidence-based practices section. So this ties to the first document that I shared with you all, that PDF. So you may remember there has been an evidence-based practices section here. Right now, it's just a little shorter than in previous years because that information was taken and placed in that separate PDF for you. So we just have a paragraph here talking about that, kind of directing you back to that PDF. And then we also added a statement around Triple P that we would not consider funding it as a standalone program. So just wanted to clarify that expectation in case you're interested in incorporating Triple P, just to make sure that it is included in another program. So that's another small change. And then I'm going to jump down to our outcomes section. We'll take some scrolling. So the format of this section hasn't changed. It's still separated by consultation and prevention, and then you'll see recovery, support services, and then something on treatment services. I'm just pausing here to encourage folks to make sure that your CQI people or anybody else who does your reporting who might not be on the call here today takes a look at this section, because these will be the outcomes that we would expect to be measured for those programs. So we just want to make sure that there's a connection between your CQI reporting folks and then this those that do the RFP. I think we did tweak a couple programs. We've been in contact with providers who that applied to, but I would still just encourage you to review the outcomes. I know in the RFP narrative, there's a section where, you know, you can be agreeable to what's outlined here, but I would just really encourage you to take a look at what's expected to be measured and then reported for fiscal year 26, because I know sometimes the CQI people differ from the people who write the RFPs. So just wanted to put that little reminder out there. And there's just two more changes, and they're pretty close together, so I won't be scrolling much after this. Trying to get to flex funds and hardship. Here we go. Okay. So flex funds, we expanded this section actually compared to last year. So we added some more context for how those funds can be used and accessed. We still will be maintaining an internal budget line for providers to submit an application to have flex funds considered for approval. And so these couple paragraphs, I mean, really are taken from the application itself. So just kind of reiterating the use for those funds. We also have the same kind of exclusionary list as previous years. If you've been with us that long, these haven't changed, but we just wanted to, again, just kind of spell out the use of the flex funds. And then this talks a little bit more about the process. It's to be used on a case-by-case basis. Hopefully, if the client is connected to a treatment provider, the ask should come from that treatment provider. So we do have hopefully a clear statement here. So because we'll have it in an internal budget line, it'll be the same as current fiscal year. You don't have to include those dollar amounts in your RFP budget because we'll have that here internally. So there are exceptions to this, and if you're on the call, you know who you are. We do have them outlined and specified here because they bill heavily on flex funds, and so those are some programmatic exceptions. But otherwise, you don't have to worry about including those in your budget. Okay, hardship funds. So we did add this back in to the guidance document. So you'll see that they can be used to cover private copays or deductibles, specifically if the client's not eligible for Medicaid. So we did add some direction to the 2 forms that are available to treatment providers who are interested in accessing hardship funds. And so one is the copay waiver form, and then there's potential Medicaid waiver form. That potential Medicaid waiver form, there's a direct link to it. You can fill out and send that, and that gets received, I believe, by our Partner Solutions department. And then the copay waiver form can be accessed upon request by emailing the Smart Care Support email address. So they'll get that form sent to you if you reach out asking for that. And so there may be more instructions and information in that Partner Solutions Smart Care Provider User Manual. So we just wanted to kind of spell out how to request accessing those funds. So hardship funds are also something that you don't have to include in your program budget. And lastly, interpretive fees. These are fees that you can put in your budget. If approved, they'll be on the provider rate sheet. So they are considered separate from flex funds. They'll be billed on units if you're already used to doing that, up to the max rate. And so we do ask if you are requesting them and they're approved, please maintain documentation of use of them. Because when we do our documentation review, if those are claims that come up that have been billed to us, we'll look for documentation around that. If you've been with us for a bit, you may remember this chart here. So we included it again just to kind of help if you're interested in putting those fees in your budget. So here's the service code number and the name and the rate that you would plug into your budget. So hopefully that kind of helps you complete that portion of the RFP if you're interested in including interpretive fees in your budget. You don't have to, but this is a guide in case you're interested in doing that. I think that's it for the guidance document. Stop so we can all see each other. Are there any questions after hearing those changes? Okay, hearing none, I'm going to move on to our actual RFP narrative and budget template. And I'm just going to pull up the full one or the one that's applicable to treatment, the changes are the same to the shortened as well as the full. So I think just the question number itself differs just because of the number of questions between the two, but the changes from last year to this year are the same for both the shortened and the full template. So let me share, I think, one last time. All right, so when you open up the template, it should open up on the instructions tab. And I just want to point out for your reference, if you haven't checked out this tab, we try to walk through each question. I'm going to scroll to the bottom because that's the only change that I just want to point out. It's around the program budget. And so we do have an example included from a provider last year actually supporting their ask for more funding than they were receiving the prior year. So you'll see that here at the bottom, and that really is the last question in the program budget. So if you are requesting additional funding than what you are receiving for the current fiscal year, you know, we ask for a reason to help support that ask. And so we saw this as a really good example that a provider gave. So we wanted to plug that in if you were looking for any guidance on how to answer that question. I'm going to jump to the middle tab, which is the actual form itself. Really, there's just some wording changes here to point out to you all. So I'm going to jump to that big text box. I'll make this bigger for you all to see the question. It's question 6 in the full version. I believe it might be 5 in the shortened, but it has the same wording. We did include in this question any substances of use commonly seen within the program, if it applies. It might not apply to your program, and that's okay. But we are interested if you are seeing any kind of trends, just so that we're aware of what's going on out there and hearing how you'll address the need. So that is in that question. And then lastly, I'm going to jump to the classes and groups question here. And it really is the same as previous years, but we added some clarifying language, just asking if StarkMar funds that you're asking for within this RFP are to cover classes or groups. We did have some folks check these boxes, but then maybe didn't need funding for it, and it was a little confusing. So we just wanted to ask, you know, if within that funding request are any classes and groups, check any of the boxes that apply, and then you can fill out that curriculum evaluation form that corresponds to your group or class type. So just a little bit of clarifying language added to these questions. But that is it for at least the narrative piece. Are there any questions about those couple changes? Right. Well, lastly, I'll just share with you all our CMP chart is currently in a draft form, and just to give a heads up to early childhood mental health providers, you probably already heard from Elena, but the name of the Georgetown model that will be listed within the CMP chart has been updated to the Ohio model. So you'll see that listed in the CMP chart in the dropdown along with Dinah. So that's the change so far. And I think we updated the school-based rate to slightly increase it so that it divides out better on our end. But that's still in a working draft form, but I just wanted to share that name change from Georgetown to the Ohio model that you'll see in the CMP chart once that is finalized. And I think that's it from my end, and I think I'll pass it on to Chris Mahaffey, our manager of accounting.
Hello. I won't take too much time speaking about the budget sections because really nothing that affects usage has changed that much. The only update that we made in the budget section is going to be on the treatment budget form. And that was just changing the rates, the Medicaid rates. We had estimated what we thought the changes were going to be last year prior to the RFP being released. So the rates were updated, but they weren't exact to what the actual rates came out to be. So we have updated those. Very minimal change. We were pretty close on all of our estimations. There were some minor changes. So those rates have all been updated. It might not even be visible to folks because if you recall, those are kind of average rates in a lot of cases anyways. So it'd be hard to tell that one rate changed by 12 cents or 13 cents or $1 here or there. But just know that we did update those rates. And that's the only changes we made to the fiscal sections of the RFP this year. So I will leave it open for any questions on that or just any questions in general at this time, since we still have, about a half an hour left in the meeting. I'll just kind of leave it open to all of that and I'll turn off my mic and quit talking.
Any Starkmar staff, feel free to jump in if I missed anything or if you want to add anything too.
I guess just a reminder for folks that this is the last chance to ask live questions. You can still use the RFP questions email. And I know Stephanie mentioned it earlier. We do get back to those as quickly as possible. The goal is within 24 hours. And then that is documented. You do get a written answer and then they are transcribed to the website as well. So
I don't have a question about finances, but before we go any further, I just want to clarify one thing. We're sending in our certification for OMAS for being okay. I just wanted to clarify that. That's all I needed.
So Michelle, you're in the process of that recertification. Is that what you're?
I just sent it in. It's
Oh, okay.
all done. It took 100 years to get everything that was needed. We just got the occupancy done, which is a temporary one, but we got it, sent it in this morning. As a matter of fact.
Awesome. We appreciate that update. I know we asked for the updated certification and it's good to know you're currently, in that process. Are you able to send I don't know, a copy of a confirmation email or a screenshot of the lax kind of showing your progress?
Yeah, what they send you is who your surveyor is, which she doesn't even work there anymore.
Okay. If you're able to just include that in your packet, that'll be fine.
Okay, I'll send that in.
Thanks for the update, Michelle.
You're welcome. My certificate does not end until the end of December, but still I'll put that in there. But yeah, this was me, I start early on everything. And I'm so thankful that I did, because this time was a complete nightmare with our building. There were so many things that they did not catch in the past 4 years that now we have an architect coming in and they're doing all this stuff. And they just gave me everything's temporary that they put through just for OMAS so they can get us. They don't want to shut us down because of the work that we do. So they're being very generous to us.
Yeah. Oh, that's great. It's a good reminder to folks to, be proactive about getting recertified, because sometimes that process takes a little bit of time. So
I started in September Or actually, I started in August.
Wow. Great. What other questions do folks have?
I had one more, and I'm pretty sure I understood, but I want to make sure 100% on this. This is my respite. Yes. On the narrative, the program narrative for my respite, I just looking back at my past, I'm like, boy, how did that even go through? Because those are ludicrous numbers. For the enter the maximum number of people who can be served by this program at any given time. I don't know what those numbers were that I put in there before. I think I did it per year. This ridiculous number. I don't know how I added them up, but that would be today, my maximum number that I could actually serve in my respite today. Is that correct?
Yes. Yeah. One point in time. What's the most that you can have? Yeah, you got it.
Okay.
Chances are someone else had that question too, Michelle. So
Yeah, well,
that's why these are helpful. Right. Any last questions? We're reading a chat that came in, so I think that's why we're all pausing here. So can we please review any special considerations, inclusion criteria for a community-based program involving partnership with the certified existing provider? That's a good question. So again, I don't think we have anybody doing that, so it's kind of new to us. I would just say, and I'd ask some Starkmar staff to jump in and help if you can, just because this is something that's newer to us, but just making sure that the certified services at the other provider kind of cover what you're interested in providing. Just making sure that even though you may not be certified, that there are certifications that kind of cover the services to be done. And obviously, both organizations are agreeable to having those services provided. Does anybody else want to add anything?
Stephanie, I think that was right on. I think the other ingredient would be making sure that whatever entity is exploring doing that with an already funded entity, that both entities reach out to us directly so that we have a heads up that it's happening. Michelle, I saw you turned your camera on, so.
Yeah, I just wanted to clarify that it would be the certified provider that would need to submit the RFP response. So I don't know if what agencies are looking to partner, but if there is one that's not certified and one that is, it would be the certified provider that would need to submit the RFP.
Great question, Jeanette. And thanks to Starkmar folks for jumping in.
I just wanted to re-clarify since I saw another additional comment in the chat. since this is our last open Q&A, they'll have to reach out through that RFP questions email address. So just a heads up, we won't be able to have an actual conversation with whoever that certified provider is right now, since the RFP is open and competitive. But they can certainly send us an email through that RFP questions address that Stephanie had mentioned. We can answer any questions that the certified provider might have, or you might have, your organization may have after today.
It's a great point. All right, any other questions come to mind for folks? We can maybe look to add some more clarifying language in that face sheet document that has that paragraph. So this is helpful to improve upon for next year. Not hearing or seeing any questions. I think that's it for this last session. So thank you all for being here. I appreciate your time today. Like Chris said, questions asked here in the chat verbally will be transcribed and posted to our website. And then this recording will soon be uploaded to our YouTube channel. So you can look for that if you want to come back to reference it, or if you have staff who couldn't make it and need to see. So thanks again, everybody, and have a good rest of your Tuesday.
Hey, Carol.
Bye.